Earlier this year, we met a couple who did a whole bunch of stuff together, including getting a facelift. Here's what they had to say about their looks before surgery.
What I didn't like, though, is that I felt that I was starting to look very tired. As my eyes were drooping a lot more, I was starting to look tired.
Well, I had some work recently done on my teeth, and it made a dramatic difference. And I've got chins that are genetic and also weight loss and gain. And so I thought if I can make that much of a difference with my teeth, then I'd go for the face as well.
Well, that was about 4 months ago, and we meet the new Christine and Ian, who join us. A very good morning to you, and their plastic surgeons, Dr. Michael Zachariah and Dr. George Marcells. One and all, welcome back to the show.
Morning.
Listen, let's just start with Christine, if we may, and let's talk through the procedures. Christine, I know we've got a shot of Christine before. How are you feeling first?
Absolutely ecstatic, actually. I'm very happy with the results. I love it.
Well, if you just look straight down the camera here. Now, Dr. Zachariah, can I ask you what Christine had done? What procedures?
What we performed with Christine was, starting from the top, we performed a brow lift to lift the brow slightly. We took away the excess skin of the upper lids, and the lower lids took away a little bit of fat and excess skin. And then we performed a facelift to the lower part of the face and to the neck. And we actually transferred some fat into the mid-face area just to make it a little bit fuller.
On the cheek line?
On the cheek line, yes.
Wonderful. Okay, now Ian, it's your turn. Ian, how are you feeling?
Actually, terrific.
Because as we heard in that before, you started, you did some cosmetic dentistry, and then you've gone, I need to feel a little bit better about myself. What was your motivation to start with, though?
Well, basically, Christine, she's always...
She talked you into it.
No, she didn't talk me into it. She
Right.
always wanted to have her eyes done, especially. And I thought, well, there's bits and pieces about me I wouldn't mind being done too.
Well, look down into camera one there, and let's explain what Ian's had done.
Yes, well, Ian was mainly concerned about his neck. He'd never had a good neckline and jaw, so he's had a face and neck lift to resuspend all the tissues there and define that some more. And we did some minor eyelid surgery just to tidy up the look around his eyes and give him a less tired look. The last thing we did was Ian had a mole on his left cheek, which you can see there, and we've removed that, and there's sort of no evidence of that ever being there now.
Wonderful. Looking at that jawline, that is a great result. Now, how do you do that?
Well, we use the deep plane facelifting technique, and we make incisions around the ears to hide them, and we dissect under the deep muscle planes and really lift and support that muscle up. We also removed a little bit of fat from around the neck as well.
How do you do that? Is it liposuction?
We use liposuction techniques.
How are you feeling about it? I mean, in terms of just your family reaction, friends' reaction?
Terrific, actually. Family was very supportive, and friends are quite amazed at the difference in the look. Yeah, really are amazed at how I can do it.
Now, as I mentioned, this is 4 months ago, and Christine, I think you had the procedure first. 10 days later, Christine followed. And as partners, did it make a difference knowing what either person had been going through?
It did, actually. Beforehand, I didn't really think it would, but we were amazed at how much difference that did make, because it's quite rare that, I suppose, you go through something like this and you've got someone beside you who's the person closest to you who knows exactly everything you're going through. So
Any
it made a big
hesitation at
difference.
doing it again? Because a lot of people, that was a lot of work that Christine especially had. How long was the operation Christine underwent?
Around about 7 hours.
It's a lot of work.
It is a lot of work, yes.
And
Yes.
you're asleep.
And you're asleep. But, you know, what about recovery time?
Recovery time was pretty quick. Ian recovered remarkably quickly, actually. I was a little bit slower, but I was back at work within 2 weeks, looking fine, wearing some makeup. And even in the second week at home, I managed to do quite a lot of work because I had to. So I would say really the downtime is about 2 weks, but we could get out and about the second week for sure.
You said you were feeling ecstatic.
Yes.
Is that what's been done for your confidence, your personal security?
It is, actually. I don't think I was particularly lacking in confidence before, but now I don't have to worry every time I meet someone new whether they think I look a bit grumpy or a bit upset or a bit tired. I have lots of different clients that I deal with, and I suppose they really need someone who looks energetic if they're going to pay you to do work for them. And I just think I look a lot more alert.
Wow. And okay, so with a brow lift, how long does that last?
It's quite variable with the brow lift, but we expect that it would last around about 5 years. And then maybe after that we will need to do a little bit of touch-up work, or sometimes we can augment it by using some Botox or fillers. And I think we did a little bit of work with Christine afterwards, putting some filler product called Juvederm just in here, and that goes away, and it's an ongoing process that we have to look after.
Little maintenance.
Absolutely.
But in terms of the eyes, this definitely the windows of the soul, and when you're looking tired, and as we age, they do get heavier.
Yes.
It's one of the first signs of ageing. Even people in their 30s start to notice getting bags. I've got some myself, although your makeup artists have been excellent to hide them.
The mole, now zillions of people in this country certainly have moles. That's not dangerous to remove moles like that?
No, in fact, often we remove them to send them for a biopsy, make sure they're not a cancer or melanoma. So it's a simple thing to remove them. I often do a little shave of them and send that off to the lab, and if it proves to be anything more suspicious, we can go in and remove it properly.
I've got to say, Ian, I think the neck looks wonderful. Just wonderful. Ian also had, what else did he have done?
We had the face and neck were all lifted together, and he had some eyelid surgery.
Like, you know, where is that, in front of the ears or behind the ears?
The incisions are disguised in
and it's by
hairline.
knife, it's not laser?
Yes,
right.
well, you could use a laser, but we use the knife, and we hide incisions around the ear and back into the hairline there.
Okay, if you had to sort of, we know clearly 7-hour operations not ever to be underestimated. Recovery time, I'm sure there was a degree of pain, but everybody forgets about it sometimes later. What about sensitivity of tissues and nerves, and has all that come back to normal?
Not quite all of it, but most of it. So I still have a little feeling that I'm wearing a very light polo neck jumper around my neck, but I don't notice it most of the time. And every week I notice there's a subtle change, there's more feeling back and so on, and it's practically all back now.
In reality, what is the absolute full time of recovery till your skin is back to normal and there's no swelling, etc.? Because swelling takes months to go down.
It does. I always tell the patient that it will take between 6 and 12 months for things to really settle down, sensation, etc. So I think around about 12 months. People can go back to work after maybe 2 weeks, but it really takes a lot of time for things just to settle back into place.
And you've both had great reactions?
Yeah, very positive.
That's great to hear. Listen, doctors, thank you very much, and thank you for coming back some months later to see the result, because everybody's been very curious.
Thank you.
And looking fabulous, and I'm glad you're happier.
Thank you.
At the end of the day, that's what it's all about.
Thank you.
Thank you. Ian and Christine joining us, along with Dr.
very much,
Marcells and Dr. Zachariah. We've got more coming up. Here's Roz.